Hi, my name is Ashton Luxgrant. I'm a medical writer at 3D for Medical from Elsevier, and today I will present to you a short demonstration of complete anatomy. For those who may be new to complete anatomy, I will give a brief summary of what the platform is and how you, as an educator, can use complete anatomy to teach students in an interactive and engaging way. Then we will dive into a demonstration highlighting our new female model that was released just last month. Traditionally, anatomy is usually learned from 2D illustrations or photos from an atlas or maybe in a cadaver lab. You can see in this video here just how limiting a reference in a book is next to a 3D interactive model, where you can not only rotate the model, but add on different system layers, as well as the motion of different muscles, and customize the model with tools such as the cut tool or adding on labels. Today, we face several different challenges in anatomy education. For example, there's a decline in the understanding of anatomy because medical curricula does not always give students enough time to perfect their understanding of anatomy. In conjunction to this, access to cadaveric dissection is declining, with many medical schools eliminating dissection labs from their practice, especially within the past few years dealing with the COVID-19 pandemic. Lastly, today's students have grown up in a digital age where we are always coming up with new education methodologies. Having a platform such as Complete Anatomy available to you through a phone, tablet, or computer allows one to access what they need at the touch of a button. Fortunately, Complete Anatomy can help solve a lot of these challenges we see. Allowing students to learn from a 3D interactive model enables faster and more comprehensive understanding of anatomy. Thus, they can understand spatial relationships, complex structures, the movement of body areas, and much more. It also meets the needs of modern tech-savvy students and educators by facilitating active, student-driven learning. Complete Anatomy, as a platform on its own, is the world's most advanced interactive anatomy learning platform. These are just some of the things it includes to help students and educators. It is the most accurate and complete human 3D model with over 17,000 structures. We have some amazing features using the best technology, such as our beating heart and full AR. As an educator, you can edit this content with several formatting tools, such as custom labels and your own images, which you can then share to your class. It is a true content distribution platform, meaning you can create, save, and share the content. There's also over 1,500 clinical videos and a growing portfolio of courses. Lastly, we have our curriculum manager, which is a suite of tools built for educators to help make your own courses and quizzes for students. Overall, I hope you can see just how beneficial Complete Anatomy is for anatomy education. But just to summarize, here are a few points for both students and educators. For students, they are able to use the highest quality 3D models anywhere at any time to access customized screens, lectures, and quizzes that they receive from their instructors. In addition to this, they can access pre-prepared courses from world-leading academics, as well as share this content with others for collaborative learning. As for educators, you're able to use this 3D atlas of the human body to customize content and then share it with your students or colleagues. With our advanced tools, it makes sharing screens and quizzes easy, as well as you have the ability to track student engagement and performance via our student assessment dashboard. Next, it is my pleasure to show you our new female model, which has only just been released, along with some of our other updates from our big release last summer. I myself was the head medical writer on this project, With the help of 3D artists and subject matter experts, we were able to create the model you see today. With this model, we hope to make complete anatomy much more inclusive and beneficial to our users. From the start here, you can see we have our female skeleton. A lot of care and work has gone into the skeleton to make it distinctly female. For instance, we have included many sexual dimorphic landmarks, not only in the skull and pelvis, but throughout the entire body. For example, if I focus on the pelvis here, I can turn on some different bony landmarks. Just turning it back slightly, we can take a look here at the greater sciatic notch. In females, this is quite wide and open. However, if I go down to the corner here on my Models tab and I click and hold, I can then switch to that of the male model. And now you can see here that the greater sciatic notch is much more narrow and closed compared to the female. Features such as this are great for comparative learning when it comes to anatomy, which can be seen throughout the body. Not only did a lot of work go into the skeleton, but also we remodeled the female urogenital system to not only be accurate, but provide more detail for users. This included efforts to remodel the external genitalia, as well as add more detail to the vaginal canal and uterus. You can see, for instance, here, that we've modified the shape of the clitoris to be a distinct J-shaped curve, which you commonly see. As well as we refine the dimensions of the vaginal canal in relation to the cervix, showing off an anteverted angle of the uterus. Next, we're going to take a look at the breast tissue of the female. This is an area where we have also made adjustments. Not only is the breast tissue much more realistic than our previous thorax prosection, but we have also added more detail to make our model the most accurate available. For example, I'm just going to hide a portion of the tissue here. And thus you will see the distribution of the mammary glands. Here you can see it's more condensed in the lower portion of the breast. Small details such as this are really important when connecting anatomy to clinical cases. Within Complete Anatomy, we also provide an array of different detailed models that help one visualize different areas of the body close up. In our new release, we have the penis and clitoris cross-section here. Due to their shared embryological origins, we thought it beneficial to have them side by side to compare and contrast their anatomy. We also now have a detailed model highlighting the ovarian cycle, where users can go in through the different phases of follicular development in one succinct model. Going back to the full model, I would like to highlight our integumentary system for the female. If I flip over to our male model, you can see here it is very much that of a Northern European ancestry. However, with our female, we have taken great care to help make her appearance more inclusive of more people. For instance, her eye color is brown instead of blue, and we have darkened her skin tone just slightly. This is only the start of how we want to make Complete Anatomy more inclusive. This next year, we plan to introduce several more models that represent people from many different geological backgrounds. Now, lastly, I would just like to highlight our atlas and courses. Our atlas is a collaboration project with Grey's Anatomy. That is, the screens are inspired by the images you would find in Grey's. You'll find that within this library of content, there are over 700 screens of pre-made content to help guide you through different anatomical regions or systems, all while staying interactive and engaging. This also includes female screens from our new model. For example, if I choose a screen here, you will see that the model is displayed with several labels that help guide me through the different structures of the model. I can simply go through and click on each one until I'm finished. Coming back to our hub here, our atlas wasn't our only collaboration with Grey's Anatomy. We collaborated with Grey's Surgical Atlas to create an interactive dissection course. Clicking on my course tab here, you can find different courses made by 3D for Medical and other third-party professionals. These touch on many different subject areas, such as Abraham's clinical anatomy, emergency medicine and trauma, orthopedic special test of the shoulder, and as mentioned before, our guided dissection of the abdomen. We hope to expand upon this in the next year and add to more regions of the body. As an educator, you can use all the content within these courses to help teach your students. That concludes our presentation of complete anatomy. Thank you everyone for watching. And if you have any questions, please visit the Elsevier virtual booth. Thank you.